the session today, please do either put your hands up, put something in the chat, and we'll get back to you and try and pick those up and make sure we answer what you've got. But if there's anything you want to let us know about future events and things that you want to hear about, please do let me or Aoife or Becky know what it is that you're thinking of, and we'll try and get that on the agenda for future sessions. Okay, so without further ado then, Aoife, over to you.
Thank you. Hi everyone, I just got a few updates today and some upcoming events as well I'd like to share with you. So the staff survey results have now been published and they're on the website for finance teams. The promotion, recruitment and retention strategy is being launched next week, so keep an eye out for that. And I can also, after this meeting, send around an email on what that is about. The next accreditation deadline is on the 31st of May. In line with this, we've recently ran an Are You Ready for Level 2 accreditation event. So this may be useful to watch back. It's on our YouTube channel if you are applying for Level 2 in the near future. The deadline for the Insights Placement Scheme is next Friday. Cohort 8 of innovations has just been published as of yesterday. We have 26 new innovations for you to look through. And there's now also an application guide for the EVO framework, which I'm sure Rich will cover later as well. But I'll pop the link for that in the chat if anyone wants to have a look through. So events wise, we have an innovation showcase session, which is focusing on sustainable efficiency tracker on Thursday, the 16th of May. We have a Proud to Be Ops session, which is an introduction to NHS finance series. We're running a few of these throughout the year, but the first one begins on Wednesday, 22nd of May. We have a software skills session on transforming NHS finance data through Power Automate and Power BI taking place on Wednesday, the 5th of June. Our next Demystifying NHS Finance session is on Tuesday, the 18th of June. We have an inclusion showcase session, which is focusing on the journey of setting up a disability staff network on Wednesday, the 26th of June. And we also have a face showcase session where someone's coming along from Barts Health and is showcasing a tool on a tool to support clinicians and managers, which is taking place on Wednesday, the 26th of June. So if you're interested in any of these, you can have a look through on our website, and I'll pop the link in the chat so you can have a scan through, because we also have loads more events further down the line as well. But that's all from me. Thanks, Jill. I think you're on mute.
Okay, so if are you going to put something out with those details on, because you rattled through a load of those? Is there somewhere? Yeah.
So what I'll do in an email after this meeting, I'll circulate the I'm also going to, I've produced a document which is a small breakdown of all of our development programs, so I'll send out another document with links I've just mentioned for everything, so everyone has those.
Lovely, thank you. Okay, I rattled through that one. Is Richard here?
I don't think so. I'll just double check. I know he was attending a bit late. No, he's not. Let me just drop him a message to.
As you can see, there is a lot going on through the One NHS Finance website, events that you can book onto. There are also those programmes that I know there are a couple of them open at the moment, aren't they? The assistant director and deputy.
Yes, and
aspiring
also
deputy.
The Career Shapers is also open. That's for band 2 to 4 staff, and the deadline for that is on the 31st of May. But I'll cover all that in the document I circulate after the meeting.
There's plenty going on.
Yeah, lots going on. Oh, here's Rich.
Hi, Richard. We've scampered through the first bit of the agenda, so you're up.
You've definitely scampered the whole 20 minutes. I'm flying in as quick as I can. Let me just get my presentation going. How are we all today while I click away in the background?
Is
Thumbs up from Luca there. Hi, Luca.
Is anybody on the call actually involved in EVO at the moment?
So that would be people from University Hospitals, Birmingham, North Staffordshire combined, or Lancashire teaching. So
probably not.
Not UHB, then
Oh,
not.
super.
Okay.
A very attentive audience then.
Show of hands, how many of you are in costing while I continue to find my deck?
We've got a few.
Excellent. Right. Okay, so I'm going to talk to you today about Evo for about half an hour. Has anyone, show of hands, seen or heard this or seen me before talk about Evo? Let's start there, shall we? Becky, you don't count. Yes, hello. Yeah, okay, fantastic. So, okay, great. So, I've been presenting on this for quite a while now, and we're now in a stage where we have a full physical handbook of Evo. So what I'm going to talk to you about in this presentation is going to essentially be a 10-minute sort of overview of what it is, using the analogy of space, because why not have a bit of fun on a Wednesday? And then we're going to go into 3 of the value tools that teams who do Evo will learn to use throughout the sort of 20-week process. Those value tools will essentially allow those Evo teams ultimately to come out with something called a value impact comparison score, or VIC score for short. And that VIC score will allow them to articulate at a specialty and service level in trusts how they have transformed clinical pathways or specialty and service for the better over that period, and articulate that in terms of both quality improvements and also cost as well, which helps with the efficiency and productivity ask as well. So good. I've sort of filled the time while I found my slides, which so can anyone, if you could just give me a shout and let me know that they are up, that would be great.
They're up.
Lovely stuff. Right. So, okay, we've sort of done that, haven't we? Okay. So, what is Evo? Well, it stands for Engagement Value Outcome. And basically the ultimate goal of this framework is to help teams in trusts teams generally improve patient care at the system level. And they're going to do that by supporting evidence-driven, value-based decisions at the specialty and service level first. And I can talk to the end if we have time on how that relates and scales to system-level transformation as well, because it all links together. So the framework itself, as I said, it's a physical project management handbook about this thick, which will be posted to trusts on completion of a successful application. There's also a digital version in there as well. And this handbook's essentially got over 100 resources, scannable and clickable and downloadable, briefings, presentations, all sorts of bits and pieces from lots of collaborators to help you on your way during this process. So to apply, the application actually requires your medical director, your director of finance, and the trust board to sign a commitment statement for Evo. And basically why we've got an application in there, because it's entirely free of charge, is to essentially ask the leadership to protect your time to do this stuff, because actually not a lot of this stuff is new. Ultimately, what the real challenge is finding and protecting the time to be able to use finance data, PLIX data, whatever data you have available to evidence and implement transformations at specialty and service and clinical pathways. And that's really a challenge to find the time to do that. So that's why we have the application process, because it makes them sign a schedule that you agree to and they agree to, and gives you time to do the good stuff, like improving patient care and being able to evidence it, which is always good. So essentially, the handbook is delivered in trusts by operational, project improvement and costing staff. And essentially, there are no external parties involved, so we aren't involved in the process at all. You get everything sent to you. We're there to remotely help you understand the book and the process, but essentially it is yours from the moment it arrives, and you can sort of fit it in a bespoke way to your processes as they exist if you've got quality improvement output or transformation output, etc. But also you can implement it as a whole sum from the very base to the very end, blow by blow, as it were. And the focus is firmly on prioritizing the health outcomes for patients, but using the available resources, which is really important at this point. So, right, that is a value equation, basically. I mean, this is the value equation that we use. Value, as you, I'm sure, know, is defined in many different ways, endless number of ways, actually, it seems. And as a result, I think it's actually regarded as more of a concept or theory of measurement rather than an actual measure itself. So EVO simplifies value and allowing teams on the ground to use it as a practical and tangible measure of improvement. That's what we're aiming to do here. So value for the purposes of EVO is basically defined as outcomes or quality relative to costs or resources. So that's basically to say it's widely acknowledged that focusing solely on cutting costs without maintaining or enhancing the quality of care can lead to false savings and harm the delivery of effective care. And that principle is very hard to argue with as value-based healthcare, really. So, as I've said, the focus is on sustainable quality improvement, and it brings together sort of your QIP and SIP, your cost improvement, your quality improvement, and the finance and clinical teams that are expected to deliver these under one numerical measure of improvement, and that's the VIX score, which I'll talk to you about in a bit. First, I'm going to talk to the process itself. So, who have we worked with? So we work with lots of organisations. You'll see Nottingham there with the WAVE programme. Those of you who heard about the great work those guys are doing there. The Royal Free under the clinical process groups. There's lots of case studies and stuff that's available for you to see the work there. And Leeds with the waste reduction programme. So EVO in the handbook assumes base levels of capability at that point. So if your team is not quite confident about sharing dashboards that can be clinically present to clinicians, that's fine. We've worked with Making Data Count, and the resources in there will help teams at any level essentially develop and present engaging dashboards through the use of SQL. It brings in temporarily your informatics colleague for those skills as well. And also potentially a business analyst can come into the EVO team to help you out. Again, this is all designated as part of the framework. Project management. So it's a project, about 24 weeks. And we've worked with the HPCA, the Healthcare Projects and Change Association. So if you've got a PMO, great, probably use them because they've got their methodology. If you haven't got a PMO or a project entity in your trust, then, and you've got a team being that wants to run the project, then they can take all the sort of online learning and bits and pieces and resources that are available via the HPCA through the handbook, and they can get up to scratch to definitely run that project end to end. And then we work with QSA as well. So there's a lot of QSA sites, quality service improvement redesign, and there's a lot of resources from them in EVO underwriting all of the quality elements. So if you're familiar with the QSA methodology, you'll recognise a lot of components within EVO as well. And that's just a few of the people we've worked with in terms of resources, and obviously the Healthcare Costing for Value Institute as well. There's a lot of case studies and bits and pieces that we've worked with them on as well. Just trying to gather all the useful things that exist and turn it into a very lean sort of output focused process for you guys to crack on with. So I'm going to do a little space analogy now, which will be fun. If you don't like space, then get ready to change your mind. And that'll go on for sort of 7-8 minutes if I don't waffle too much, and then we'll get into the real detail of some of the value tools that you'll use throughout that process. I'll pause in the middle so you can ask any questions as well. I can't see my screen, so if there's anyone asking any questions, please just interrupt me. Right. What's the mission? So Your Home Planet, an NHS trust, has submitted a successful application for a rocket exploration program called EVO. So this program will ultimately help to improve the quality of life for the population on your home planet. So Your Home Planet has identified 3 areas specialties and services, that will be the subject of the mission. So each of these 3 areas has put forward a flight crew, and each crew will then launch their rocket at the same time and orbit around their planet. So each crew's mission is to orbit the planet they share, each observe their specific area from space together, and use the information gathered to agree on a plan to transform and improve it for the benefit of all who live and visit there. So this handbook gives the crew everything they need in order to complete this mission. Now, we've managed to go back in the slide deck, so that's good. Okay, so who takes part? Individuals from 3 core disciplines are needed for the mission. You've got finance, you've got clinical, and you've got project. So you've got different tiers of roles involved. So first off, you've got the Evo champions. So they're collectively responsible for sponsoring the entire mission. They'll be the ones that signed that rocket application program. Champions are not part of the crew, so they don't get to go to space, but instead they support from the ground. And then we've got the flight crew. So we've got the Evo leads. So the Evo leads are collectively responsible for a successful mission and each have different roles in the crew. The finance lead, you can see there, is responsible for the rocket's engines, which use data as fuel for propulsion. Work with me on the analogy here. Then we've got the clinical lead. So the clinical lead in each rocket they'll be the rocket's captain, as they know most about their area back home. And then you've got 2 project leads, and they're responsible for the navigation and will guide the rocket's orbit throughout its journey. And you've got some lovely Evo participants there. So they're subject matter experts, and they're encouraged to share their knowledge with the crew to support a successful mission. Okay, so our team will have, our crews will have applied for the rocket program, and the handbook will have landed at the sort of base camp, I guess. And what you're going to see now is essentially sort of 3 phases to the mission. The first phase will be launch preparation, then we'll have the Evo journey, and then we'll have the Evo transformation. Okay, so launch preparation first. So you can see there, what we've got there is our finance lead, our 2 project leads, and they're going to spend up to 4 weeks after receiving the handbook, learning it, how to understand how the rocket works, what trajectory an orbit should take, and what the crew should do in the event of any unexpected variation to their flight path while flying around. Okay, so then we've got the second phase, which is the Evo journey. This takes 16 weeks. So this central component of the mission, essentially, we've got our 3 crews in 3 separate rockets. They'll take off at the launch, they'll orbit their planet, and then they'll essentially observe their areas on their planet from space, and they'll all land together on their planet at the end. So there are 3 stages. So as I said, we've got the launch, we have the orbit, which consists of formulate, evaluate, allocate, and decide and plan. And then you've got the landing. So there's a few other components on here. So we've got the data burns. So they take place at the beginning of different stages and they propel the rocket forward. And you've got outcome markers. And these essentially act as waypoints, and crews that use these to basically self-assess their rocket's progress during an orbit. And broadly, a rocket that reaches marker 3 indicates that its crew is on course to achieve all of its mission objectives. So I'm going to go through a little more detail on each of these, still maintaining the space theme because it's fun. Right, so the launch. The launch marks the start of the mission. It'll bring together the champions, all 3 flight crews, and the crews will gain an understanding of their mission, the timescales involved, and the different roles each crew member has. And all 3 rockets will then launch into orbit. So the orbit lasts 8 weeks, and you've got those 3 stages. So first one's formulate, and broadly 2 things will take place in the formulate stage. So crews can expect to agree on 3 hypotheses or hunches that they think are likely to improve their area back on their home planet. And the second thing is they'll agree a number of measures which will then help them to assess the viability of each of those hypotheses later on, which is the most appropriate. Second, so you've got the evaluate and allocate. So by performing a data burn, and the crew will use the evidence gained during that data burn to evaluate the probability of those 3 hypotheses. And then they'll agree which of the 3 markers each hypothesis should be allocated to. Essentially, the objective of this evaluate allocate bit is to get, you've got 3 hypotheses, and you're going to get by the end of the evaluate allocate stage to 1, and you only need 1 by the end of this. And this sort of process will dictate which marker the rocket will reach in the final stage. Now, I'm not going to go into too much detail here, and I can do offline, but essentially, if a crew has had a successful data burn, they've completed the objective and evaluate and allocate without any issues, then their rocket is likely to reach marker 3. And a crew whose rocket reaches marker 3, they'll return home to their planet having agreed on a plan to measurably transform their area back home. They'll also have agreed when these improvements will be implemented, and they'll also, which is key, they will have a date at the end of that process to meet and assess the impact of those changes. Now, a crew whose rocket only reaches 1 or 2, you can't fail in orbit because we're all coming back to land and we'll all share all our experiences. So those teams can expect to reflect positively on their orbit, and they can learn a lot of stuff ready for their next orbit in the future to hopefully reach marker 3. Right. So after all that, all crews have essentially finished their decide and plan stage. Then they'll come back and for the landing. And it brings together all the crews. Our champions come back, and once back, improve the effectiveness of future orbits. So, but then we have a 3rd phase, which is the transformation. So having landed, the crews that reach marker 3, those that reach marker 3, will have a plan in place to transform their area. So this EVO transformation is expected to take a minimum of 4 weeks. Total duration may be longer. It's dependent on the scale of the transformation, etc. And you might need other people back on your area, on your home planet, to implement the changes. After these changes have been implemented, the crew will then meet to conduct a final assessment of their mission and measure the impact their improvements have had on their home planet. Okay, so I'm going to pause there in case there's any questions before we go into more detail and less space. Are there any questions, or shall I barrel on for 5-10 minutes and do questions at the end? What do you reckon?
Nobody's popped their hand up, so I'd suggest you carry on, and we'll bombard you with questions at the end.
Lovely stuff. Right. No one was expecting sort of kindergarten play days. Remember play days back in the day? I don't know if that still exists. Right, but you got to have fun with this stuff. Okay, so I'm going to share with you 3 value tools that our crews will use through that 24-week process. I'm assuming broadly this is a load of value makers. You're all finance, so you know what Plix is, so I'm not going to tell you what Plix is. It's very useful, it's very frequent, and Plix can primarily be used, and it's particularly useful because typically you're going to be able to get new data set or refresh data set quarterly, ideally. You trust to apply don't need to be running quarterly Plix. What they need to be able to commit to is running a Plix at the beginning of the EVO process and at the end. And that's how we have our comparative data to be able to measure the transformation. And I can talk in more detail about that requirement as well. So what we want you to do, we've got our value equation here. We spoke at the beginning. So just be mindful of the qualities in yellow and resources are in red. And for the purposes of EVO, the resources are going to be measured by our Plix data and also our other data sets. So we've got GIRF, we've got SLR, we've got model health system. We've got a variety of data sets there, but primarily we're going to be looking at the resources and the activity and resources measured through Plix. Okay, so where we're going to go now is we've got our first in our formulate session or formulate stage that I talked about them. So I mentioned a few measures that teams are going to use to decide. So what this is in the first session, in the formulate session, we've got our EVO crew, and what you're looking at is a maternity services example of this. You'll notice the yellow and the red sort of indicate the value equation there. So you've got your quality outcomes, and then you've got below, you've got your resources there. So what we ask clinical teams at this point is, what does good look like for your specialty? Now, our clinicians and our teams are going to have a good idea of what good looks like. And essentially, this tool takes them through a process of turning those from sort of value criteria into value metrics. So these are measurable elements. They're going to go through a process of prioritizing those metrics. So you've got good ideas of indicators of positive outcomes under care outcomes, user experience, safety, quality, etc., and cost. They're going to go through and define all of these. They're going to be very useful later on, but then our teams are going to shelve those until later on. Okay, so we've got our quality outcome measures loaded and ready by the end of that first session. Then the next tool I'm going to show you is happening at the end of the process. So if we imagine our crew has gone through evaluate and allocate, they've got their 3 hypotheses for transformation. They've gone through that process and they've found one opportunity for clinical transformation by the end of that stage. Then through that, they're moving on to the decide and plan stage. And this next tool is going to be used at the beginning of the decide and plan stage. Okay, and we're going to use our value metrics that we've just defined. These are all Excel tools. All the instructions are built in, of course, as well, and they're very easy to use, and we can take you through them as well. Okay, so what are we looking at? We've got our value metrics that we defined in session 1. We've also got the weighting. Now, broadly, we'd look at a weighting of 80% quality and 20% cost. This is changeable. However, we're not going to go into the area of negotiating what that looks like. Ultimately, we would suggest continuing on this, but this is going to be at your Evo crew's discretion. And this will be obviously very transparent. In addition, we've also got risk factors and strategic factors we're going to enter into this calculation. And what we're going to do here in this tool, you've got your opportunity for clinical transformation, and your Evo crew is going to need to decide on the different options for how you're going to tackle that transformation. How are we going to change this to tackle that opportunity for transformation? And generally, there'll be a number of options that we could do: disinvestment, reinvestment, clinical pathway redesign, whatever that looks like, they will exist. So it's important we assess, the crews go through a process of assessing and rating them. Okay, so what do we got here? We've got 5 options, and our crews are going to go through a process of a Likert scale. So that's 1 to 5. And you can see each of these options are rated across the rows based on those value metrics, 1 to 5. And 5 demonstrates clear, measurable value generation, low risk of failure, and full alignment with strategy. And 1 demonstrates sort of unclear, the inverse of that, basically. So unclear or poor value impact, high risk of failure, etc. And we can see through this process in this tool that this team has identified option 2. And what's really useful about these is they're all going to be screenshotted and put into a transformation statement, which is a 2-3 page PDF max in size. And all of these sort of visual elements can be shared and are given context in that template. What's really important about this is we can present a transparent decision-making process. So if we're asked why we did certain things, crews can be very clear about that and very very transparent about that, which is important. Okay, so our crew's got to the end of their decide and plan. They've decided on the option they're going to the way they're going to tackle their clinical transformation, and then they've got a period of time that's going to take place, so let's say the next month, to transform that pathway. And they're going to engage on a process which we're calling PDSA plus. There's going to be, if you're operating PDSA, that's great. If you've got a different quality change or a process and safety and all the rest of it, you've got a process, we're not touching that. You can use that, absolutely. But the plus component's really important. That's where we can measure our PLIX during that time, during that month. And that's going to be really important. So if there's any lessons to take from the whole thing, is if you're doing any change or process and it's possible to measure that PLIX information beginning and after in a bookmark fashion, start doing that. That PDSA plus is going to help us understand the activity and resource information. Okay, so, I forgot the pretty graph. Love graphs. There we go. That's just that articulated in a different way. Option 2 is the best. Great. Right, we've done our transformation. It's a month later, we're sitting down with our Evo crew to meet and talk about the value impact that this transformation has had. you will see that we've got 80% weighted. So this is just our quality assessment here. So for the moment, the cost bit is taken out of this. We've got our value metrics, which we've defined in session 1. We've got our weighting, which is fixed. And this projected pathway, the score here, is essentially just copied and pasted from our option 2 ratings that we did in the previous session. Transform pathway. This is blank at the beginning, and our teams, having done a month of the transformed pathway, are asked to look at the value metrics and reassess that transformed pathway after all the information that they've learned through that last month. And that may differ from the projected pathway as well. As part of this conversation, they'll also now look back 24 weeks before Evo came along, before any of this happened, and what the team would revert to if these changes weren't accepted. And then we've got quality aspiration there as well. So with a few more tweaks, another PDSA plus cycle, etc., what can we aspire to improve with quality? With the assessment complete, all of these scores then go into the value impact comparison tool. There's nothing new here. We've got our 80% quality elements. We've got our metrics. We've got our weighting. This is the original pathway, and this is the transformed pathway. Then we move through with the quality score at an average percentage. And then we've got our resource score. Now, in session 3 in Decide and Plan, we used our Likert scale for the resources element. However, because the crew's done our PDSA plus, you will have the PLIX information. And what we're seeing here is percentage cost variance from budget plus or minus. And we can see with regards to this transformation, we've recorded a plus 15% change. And that's weighted at 20%. The combined score for 80% and 20% on quality and resource. And that gives us our VIX score, or value impact comparison score. And we can report a 35% improvement. And that's quite compelling. If 24 weeks after your director of finance, your medical director, and your board have all signed essentially commitment to the program, you've potentially got 3 specialties or services that are able to articulate transformations at the specialty and service level that indicate a 35% improvement, factored in with quality, factored in with cost, strategy, and risk as well. And in addition, can sort of point to a 4% quality aspiration if we were, able to continue with that transformation moving forward as well. That's going to be quite a useful tool to be able to start talking about and addressing the productivity and efficiency pressures that exist in organizations at the moment, and the real difficulty you guys have got of being able to evidence all the great stuff that we know you're already doing. And this is what Evo will look to provide a way to measure the good stuff that you're already doing in terms of quality and cost, so that we can improve in that healthcare and sustainably measure healthcare improvement this way. Probably going to run over, so these are the outcomes. I'm not going to do many more bits and pieces. The system bit, I'm going to close the presentation. I can talk to this. We don't need to look at another cartoon image. So the system bit, finally. So this is already happening in one of the patches in the Northwest, but ultimately, if organizations are doing the Evo process for 24 weeks and are looking at, for instance, the same specialty or service, we're seeing TNO in up in Lancashire and South Cumbria, then they can go through that process of consolidating the quality improvement and cost improvement language into value impact comparison. They'll go through that in their organizations, which is really important. And because they pick the same specialty, what we're seeing is at system level, they can look to meet at the end of that process, all with the same language of improvement and measures for improvement, all talking about the same specialty. Because if you try to do that, try to do that all at once, consolidate quality and cost at a system level with 7 different organizations in your patch, it's going to be extremely challenging to do so, which is why it's so important that we start at this system level at organizations and move through together in that way, so that we're doing the language bit first, the learning and improvement bit first, and the engagement bit first, before trying to boil the ocean with the system bit. Also, there's an element of bringing together the PLIX data at that product provider collaborative level, so that we can start looking at data together as a system, which is obviously the lovely population health bit that we all want to get to, but aren't quite sure how, because there's not a lot of data knocking around. Thank you very much. Are there any questions? Lovely to see you all. Thank you. Luca?
More than a question is really something that I would like to stress about the importance of senior sponsorship. I mean, my experience with the WAVE program in Nottingham University Hospital is that whilst the tool is very good structure approach to get quality and eventually efficiency, if left at division level and not if you don't get the kind of executive sponsorship, is left to the will of the division, then it depends of people involved and not necessarily the intent, but sometimes it's just the prioritization that is done in a different way. It doesn't, it's not very all the time successful, or starts, it doesn't finish or continue, is not sustained. But having the executive sponsorship allow us, the clinical director, medical director, and the finance director, to make sure that the conversation between the quality in clinical and finance is there, and then accountability is expected from the people who are delivering the scheme. And that, I think, it makes a big difference, especially on the sustainability of the intervention, because sometimes you get the support from PMO, from the costing team, from transformation team. The job is done, everything is delivered, but then with time, people just revert back to what we're doing before. So that is I think, having a senior visibility almost create incentives to make sure that these are sustained and people are engaged and put the time and effort.
So the pilots demonstrated exactly that. I don't think there's a question there, but we completely, that's why we kept and have the application process at all, because actually without this stuff and without that senior sponsorship, you know, they shouldn't be involved in the process, because they can disrupt that. It gets very complicated when you're trying to disagree with your manager or whatever, but that's why they're set outside of the process. But when an application comes through, we don't release any of the materials until the entire schedule, and that's every single session, and the dates for them are completely agreed all the way through. Launch, all 3 orbits, all 9 sessions moving through, and moving to the landing as well. All those are actual dates completed by and signed by the board. So we take all of that out of the entire process, because that, buying that time and getting that time, that's a lot of the challenge and a lot of the reason things derail, which I think Luca was pointing to. So we learned a lot of that from the WAVE, and it supported that in the pilots as well. It's very important. The application process seems like a real inconvenience, because a lot of people just go, can you please just send me the book? But actually, we're very confident that if we did, it would get left on a shelf and be, you know, more unsuccessful. So I think our role there is just as a witness to those, the board and the director at the director level, to just acknowledge that there's protected time here, and you have the license for the clinical teams to commit. It's built very, very lightweight clinically, and that's on purpose, of course. So a lot of the preparation and under stuff is done by the project leads and the finance lead. We only ask what we absolutely need from the clinical teams in those sessions themselves. The rest of that work is done by the allocated resource. Completely. Yeah. Glad to hear you into the same conclusions in a way. Hello.
Steve.
Hi,
How you doing, Steve? You all right?
Yeah, good, thanks. See you.
Yeah, good.
So I've seen a few of your presentations a couple of times, and every time I see them, I come away really enthused and say, I really want to do it at Leicester. I think it would bring together a lot of different things that people are doing in isolation at the minute, that maybe don't talk to each other in the way that they should, and don't bring together all of their skills and resources in a way that would mean that we can really enact change. So I think it's a really great thing, but every time I talk to those different individuals, I struggle to get any engagement. So I guess, do you have any recommendations or tips about how we get those people on board, or is there one particular person in the organization that you think, if you went and spoke to, you could get them to dictate to everybody else? Is that I mean, we're in a slightly awkward place at the minute that our CFO is just about to leave, which doesn't help. So yeah, I don't know, I'm just after tips in terms of how I can get the rest of the organisation as enthused about this as what I am, and get them to see the value really.
So that's what part most of my life has turned into. I keep getting dragged into calls with no brief, into a room of people I don't know, and asked to just, convince everyone. And sometimes people are nice and give me some information on who on earth I'm talking to, and sometimes they don't. That's part of the challenge, isn't it? To try to articulate the benefits of this and why they're doing it. Now, I'm sure you'll understand the costing pitch actually is completely different to the pitch to the clinical teams, to the CFO, to the transformation directorate, because they've all got their own priorities and what they have been doing. And the actual challenge is what I'm doing already isn't good enough is generally the idea, and actually that's how I can help. So what I would say, though it sounds brazen, just give me a call and put me in front of them, and then we can start there. It is ideal if you have at least one of those three champions on side to a degree. If you're completely cold, that's fine as well. Actually, where I've found the most traction is if that's the case, and costing really want to do it, but that's as far as it goes, then I can even approach them without mentioning your name at all, if it's politically sensitive, and just go, oi, I think you should do this, great, and then it's all on me and I can make a fool of myself. Or you never know, we end up convincing them and it's a happy accident, and I can go, who's Steve? Steve looks after your costing, is it? And so there's lots of ways we can do that, but please view me as an ally in convincing those, because I'm doing that pitch all the time. And if you're particularly need to convince someone, we also have some pre-releasing welcome packs. So as part of one of the resources, when the launch kicks off at a site, we've got a PDF template that essentially is circulated to the clinical leads to sort of articulate what this is in their terms. And what we found with the non-finance element and some of the champions, that's actually quite a useful document to give them before, to convince them to get involved and sponsor the process. If you want that document, email me and I can share that with you. And that sort of does away with a lot of the space stuff, which is hard to translate to people. I appreciate it, but it does get you excited though. So some element of it works. But when we're looking at actual organization investment and risk, there's a lot of hard stuff that needs to be done there. The welcome packs I'm sharing with people that get in touch, because that's actually works out a way to go, quality improvement is great. All this is just giving you the evidence to be able to justify and evidence the need for those changes that you want to make. That's very appealing to the clinical teams as well. On top of that, we're going to start doing just going after the what are they called? I think demystifying NHS finance network, which is just banks and banks of clinicians, which AK runs for FFF, to try to improve the visibility of this from a clinical end. Because actually, once we get that value-based bit over the hill, that's actually quite an easy sell, as it were, if it comes from the clinical teams. So just call me and who you're after, and we can work out a plan.
Great, thank you.
Thanks.
A quick one from me, Richard.
Yeah.
I work in an ICB.
Yeah.
What sort of engagement have you had in ICB? How can we get involved?
Yeah. So get this every time. So ICBs. Oh, I feel sorry for you guys a bit, because you got no real data to get your hands on. How can you make decisions without any available data? We'd love some of that lovely Plix data that's knocking around in the system that I hear about. Why can't I get my hands on it? Right. So those three value tools that you saw, in fact, not the last one, but the first two, are taken from a toolkit called Best Possible Value. That's a freely downloadable presentation deck of 12 tools. We redesigned and republished it in August. You can have that right now. There's no application and no hoops. In there are ways to make value-based decisions. Some of the tools are you're not going to find useful. And basically, but some of them are in there. So that wasn't your question, but for systems, at the moment, we've got BPV on the hill. My intention for this year is to work on that into and turn it into a very lean decision-making process for systems, because you guys need to be making decisions in the absence of a lot of very useful, timely data. Putting that aside, so that's a resource for you guys in this space, and hopefully we're going to, I'm going to try and work on that this year if we've got time. How do you get hold of all this lovely data? Unfortunately, no, fortunately, the roadmap for Evo, and we're starting at organizational trust level, it's really important that we try to bring this Plix data as a system, consented for by the providers in that system, to the ICB and a view of the ICB, so that at a provider collaborative level, at the very least, we've got a holistic picture of secondary care data each quarter. Wouldn't that be just lovely to start making slightly more informed decisions about commissioning, but also services, etc. So what I would say is, for ICBs in this space, for Evo, get your trust to do the framework, because ultimately, if you have your trust managing to do this framework and they are encouraged to start believing in the usefulness of Plix data, that will that is your quicker route to getting access and you being able to use that data at system level. It's not the quick win that you want, but if we don't do this trust bit first, we generally across the country, we're observing that actually this very valuable and useful data set is primarily being used in a large number of organisations just for submission to NHS England as part of the national cost collection. That's not its best use. Don't quote me or get me in trouble. I'd appreciate that. Thank you. Its best use is local. Now the format and the standards are very useful for being able to standardising that data set, and sending that to NHS England is really important. However, it being played back to trust is taking a rather long time. That playback is going to be really important. If that was being played back to trust quarterly, then we'd actually have a different scenario and we'd start being able to use this in Evo. So because of that, let's say distraction, we want to start getting trust through Evo to start using their Plix data locally themselves through their dashboards and making data count and all the rest of it. So we're sort of skipping around that bit there to try to get organizations to start using this in a timely way, because Plix is not for reporting. Plix is for improvement, and that's just what we're saying basically. So we can use Plix to start comparing improvement in that way. It's a long answer, but it's a long way to get Plix to your eyes as an ICB. But you guys have got to make really tough decisions at this point with the support of your trusts in your systems as well. Give me a shout about BPV if that's helpful. We're trying, but if you could encourage use of Evo, that would be fantastic.
Okay,
sorry.
Thank you. Luca.
Not much of a question, but more a reflection related
Yep.
to the question that Jill asked. And I assume that a system, and I joined ICB only a few months ago, so I'm relatively inexperienced. We don't have Plix, but as we implement a digital infrastructure to work on PHM and population health management,
Yep.
that is the data, and probably the Evo could be applied to implementing the information, or using the information that population health management takes from the system, and where the intervention should be done, all the engagement, all the clinical and the option. And it seems for me that could be the next step. So correct me if I'm wrong, but that's my view on system using Evo.
So absolutely. So Evo was created primarily to bring Plix up to that system level, and that's the sort of the first thing I said about the goal. Now with BPV, best possible value, this is what I'm talking about in terms of trying to turn that 12 toolkit thing into a similar thing for Evo, because what we don't want is to skip that really valuable Plix data, leave it in trust, and then we're just making systems decisions as a system with this really valuable data set left in the wings. So what I'm trying to do here is Luca, for the two to meet in the middle, and then they'll be called the same thing or whatever. But if best possible value can be arranged around that these data that you're talking about, then ICBs can continue making decisions. And in the meantime, the Evo bringing Plix up can come and meet that, and then we're all talking value impact at this point, and that's all happening. So these sort of the decision making methodology around value impact, I'm trying to we're trying to organise that will happen in both places, but it's the consolidation of the data sets that are going to give the fullest picture for primary and secondary care. So yes, absolutely, and yes, something is coming. It's just finding the resource to be able to work on two ends. But in BPV, you'll see very similar process, lean decision-making processes you see in Evo, but we don't want to move one to the other because there's a risk that we'll forget the very, one of the most granular data, well, the most granular data set in secondary care, if that makes sense. So trying to do it all and bring it all together, we hope.
Fingers crossed.
Yep.
Okay. Any further questions for Richard?
Oh, the ask for value makers. So your value makers in your organizations, get them all to do Evo. Super simple. And if you need any resources or help, just give me a shout. I'm sure I can send you lots of lovely stuff. You are the, as Simon Worthington called you, the boots on the ground, the army of value makers on the ground. So this is how we've got 5,000 of you in the NHS, and believing in change and implementing value. This is the stuff that we're trying to give you as your tools for arriving at that population health level of system change. And if you like it, please let me know how we can help you be the ambassadors for that stuff. Or if you've got any suggestions, it's not quite right. Also, version 2 will be coming up soon because we're all about iterative improvement. So please let me know. Thanks very much. I'll put my details in the chat as well.
Thank you. Brilliant. Lovely. Okay, we'll yeah. We'll move on to Becky. Thank you.
Hello, hi everyone. So I am just going to give a brief update from the Midlands Finance Academy. I'm just doing a verbal update today, but I will pop a few links in the chat to a few bits that I'm mentioning. And also I am assuming at this point that everyone knows what the Midlands Finance Academy is, and kind of how it links into the national 1HS Finance. However, if anyone doesn't and they would like more kind of background information on the Midlands Finance Academy, then feel free to get in touch with me. And also I'm always happy to come and do a short, 10-15 minute presentation at people's organizational or system finance team meetings to do a bit more kind of detail on what the Academy is, how it's structured, how it links to ONF. But for today, I'm just going to kind of dive straight in there with a few things I wanted to update you on and make you aware of. So Aoife did mention this in her bit at the beginning, but we just have a couple of kind of key deadlines coming up that I wanted to highlight. So as Aoife said, we have the application deadline for the Insights Placement Scheme coming up on the 24th of May. So the Midlands is rolling this scheme out, as is a number of the other regions. It was piloted in London last year, and now we're sort of rolling it out regionally. We are hoping to have some students placed in host organisations starting from September. And it's a 12-month paid work experience placement specifically targeted at those who are from lower income households and from a lower socioeconomic background. Very much in the way of Evo, it's, we're going for it, but it's going to be iterative and it's going to be kind of improved as the years go on. And this is our first year. So we have a working group who's been working really hard to pull this together. We've had 33 applications in for the Midlands, which is great. It's kind of up there with some of the highest numbers across the other regions who are doing this for the first time. And, they look like great applications, and we're very hopeful to get a good amount of placements in. We had such enthusiasm in the Midlands that we've got actually we started out with 11 host organisations, and now looks like it's going to be 10. So it would be amazing if we could fill all 10 places. We just have to have a look at the applications that come in and kind of where people are based geographically. But it's just a bit of a plea for you as value makers to make yourself familiar with this if you have not heard about it before, and I'll pop a link to the scheme brochure in the chat in a minute. And beyond kind of your own organisations and colleagues, I guess the real ask is if you have any contacts at local schools or colleges in your area, perhaps you're somewhere your kids go to, or you just have connections through kind of doing any talks there previously, please share this information. You know, it's obviously quite soon until the application deadline, but it's not a very taxing application form for the students to fill in. It's very straightforward, and we're just really doing the last push to get as many applications as we can in by next Friday. And the next steps we'll be doing after that is a shortlisting process with our working group, and after that conducting interviews, and hoping to have the students confirmed at the beginning of the summer, and then they'll be getting ready for their kind of onboarding process to start in September. And then the other deadline that I wanted to make everyone aware of is on this Friday we are closing the talent management survey, which we've had out for a couple of weeks. So this is a survey which the Academy has put together to try and pull together information from all organisations in the Midlands on where they are currently at with talent management in their teams and their organisations and their systems. This is linked to the 1HS Finance talent management survey, but it's not saying, you know, have you not survey, sorry, strategy. It's not saying, have you completed the strategy, is everything done? It's just a temperature check on where everyone's at, and it's going to go into a regional report which will be going to the National Finance Academy at the beginning of June. So I will pop the link to that survey as well in the chat, and it's for the CFOs to complete, but also a nominated talent lead can complete it as well. Also, if people want to, they can have a quick call with me and I'll help them get it done. But hopefully we'll get quite a few in by Friday so that we can have a good picture of where the Midlands is at with its kind of talent management and ambitions over the next 12 months. Something else I just wanted to also mention that's coming up that people might be interested in. So as part of the Academy's EDI workstream, we are going to be putting on four, we're calling them EDI Matters workshops every year going forward from 24-25. So we've got the first of these sessions coming up on the 22nd of May. And this is just starting out with an introduction to equality, equity, diversity and inclusion, and then training is done by a consultancy called Diverse Matters, who are excellent. I've actually gone on some of their training myself. And this is for everyone, you know, no matter what band or who you are, because it's literally just sort of a broad kind of introductory session. Again, I'll pop the link in the chat. So that's on the 22nd of May, and I think there's only a few spaces left. So just to let people know if they are particularly interested, then make sure you book soon. I was going to mention Evo as well, although obviously Rich has very much covered it, but just from a Midlands Academy perspective, you know, this is something that is so important and we're so passionate about, and I think you can see that from back in 2019 2020 when they did the pilots, the initial pilots. You know, 2 of the 4 pilots were from the Midlands, and there are already, you know, many other Midlands organisations who are coming to, you know, forward to Rich and either, you know, interested in applying or actually, you know, have applied and are getting the handbook. So in terms of the Academy's role with this, obviously just helping to get the message out there, but also, and I'm sure Rich will be doing this on a national level as well, but we're really keen once a few organisations have got their handbook and gone through their sort of 16-20 week process to bring that learning back to others through, you know, the kind of platforms that the Academy can do, because as you say, you know, convincing others in your organisation that this is a good thing to do. One of the great ways of kind of having a case study of someone who says, I've done it and this is what, you know, it did for us, can really help with that kind of that convincing element. What else? And then the last thing I wanted to mention is that the Academy has published just today a programme for our 2024-25 year. So we do have, our overall strategy, which was launched last year, but that was a 2-year strategy that covered 23 through to 25. But we've had quite a lot more, happen over the past year since that strategy was launched. So actually, it felt appropriate to put together a separate programme document for 24-25 because we kindly have had funding from a lot of organisations in the Midlands, so we are able to put together a much broader programme and more opportunities for finance staff in the Midlands through the academy in this next coming year. So we've summarised that in the kind of programme document, but we've also taken the opportunity to reflect back on 23-24, celebrate some of the kind of really amazing engagement that we've seen across the Midlands in terms of the academy and ONF. And as ever, there's information in that document about how you can find out more and get more involved. So I'll make sure that is linked as well. And I think that was going to be all from me, Jill.
Lovely, thanks, Becky. Any questions, thoughts, comments? Luca?
Sorry, it's me again. Feels like I can't keep my mouth shut today. Just a question on the talent management, and I apologize because I missed a little bit and I heard about the case study. Is the case study related to talent management?
Sorry, say again, Luca?
You mentioned about producing a case study to incentivize people's.
Oh, sorry, I was talking about Evo.
Okay. Well, now I've done the questionnaire the other day, and I'm looking at make some progress in our system. And while we can do the first part of the talent management on staff segmentation, I was wondering whether we have a success story that we can use or share to motivate, but also to take some practical example how other organizations have done, learn from other people's mistakes and so on.
Yep. So, I mean, absolutely, we'll be trying to collect those kind of as the year goes on. It feels like most people are very much at the first stage at the moment of either if they're already having talent conversations, kind of using the strategy to formalize those a bit more, or for others who actually say, yes, we have annual appraisals, but we, don't really have a separate or a dedicated talent conversation. They are very much at the beginning where they're just getting that set up with all of their staff. And obviously that needs to happen first before it starts being aggregated upwards for the senior team and the systems to start looking at pipelines and things. So where we're at the moment is just trying to understand where everyone is, and most people are quite early on in the journey. We are planning on including a couple of case studies in the regional report that's going to go to the National Finance Academy in June. So there should be a couple there, and that will obviously be shared with everyone in the Midlands. So there'll be hopefully a couple there where you can see a bit more detail about what they're doing. And then, as the year progresses, we'll be gathering as much in terms of examples and case studies as we can and sharing it through the academy. It's quite, 1HS Finance have produced this strategy, but they're very clear that this is, guidance to take elements where it's helpful for you, that you don't have to put aside what your organization has already been doing and start afresh so that it looks exactly as they've said in the strategy. It's just to use it to improve what you already do. So it could be that people's pipelines and the conversations that they have and how that looks, at an organization or a system level could be slightly different because people are just going to take different approaches, but it's still helpful obviously to share it and see what other people are doing. So we'll definitely be doing that over the next few months, but we'll have a couple of case studies you can look at in the next couple of weeks when we do this regional report for sure.
Thank you.
Lovely. Any other thoughts or comments? Thanks, Becky, much appreciated.
No problem.
Okay, any other business? Anything else anybody would like to raise, wants to ask? Anything that you'd like to see, as I said earlier, anything that you'd like to see on these sort of events as we move forward? Please do let us know what the burning issues, the burning topics, what it is you really want to know more about. please do let us know so we can make sure we can make these useful to as many people as possible. Okay. Thank you, everybody, and we'll leave it there and have a really good